first hero was my father. Sometime around the turn of the century, he and his family were forced out of their homestead in rural Georgia by the Ku Klux Klan. My father was the son and grandson of slaves. Because of having been uprooted that way, he was not able to complete his own education. He was a very smart man and had an ambition to become a doctor himself. But since he couldn't do it on his own, he encouraged me to go forth and to become a physician. So he was my early inspiration to do that. The second inspiration was Reverend Dr. Martin Luther King Jr. He recognized that true civil rights could not be achieved unless we paid attention to the health needs of all individuals, especially minority individuals in the United States.
I remember being very, very young and being at parades like the Rose Parade. There was a man who fell from the bleachers, and I remember my father being the first person by that man's side. It just made an impression on me as a very little girl to see that my father is always in a position where he wants to help people.
It's hard for me to define one important point from his legacy, but if I had to pick one, it would be founding the Association of Black Cardiologists. The reach of that organization is international. It is so well respected. It is so well known. It has put so many things on the map and kept everything that he fought for at the forefront of consciousness.
I think his other great legacy is his 9 textbooks about Black-related diseases and the history. And all of that is just imperative in the education of humanity.
Every single thing that Dr. Williams has done has been intentional to improve the health of the Black community and other communities of color. But what he's also dedicated to is increasing the number of Black men and women in medicine. What Dr. Williams has done throughout his profession is that he has not only planted seeds, but those seeds have now started to bloom and blossom. It has allowed so many of us to walk through doors that didn't exist before Dr. Williams. The fact that Dr. Williams has been responsible for mentoring and guiding and supporting generation after generation of Black doctors in this country is just phenomenal.
When I reflect on my career and think about the experiences that have kind of influenced my choices in life, I have to go back to before I got involved in healthcare. I was looking for some way to get involved with the community, so I was introduced to this former nun who was starting a street ministry. She was the person who taught me about social justice. She really was my inspiration for what I've wound up doing. And I quite often think in a tough situation or a situation where I think somebody isn't being treated fairly, I go, what would Mary Jane do?
One of the defining moments with John Baackes was his absolute focus on bringing the same healthcare that you and I have grown accustomed to, the same level of sophistication in terms of the clinical impact that patients experience to the most vulnerable patients in this county. He understood and focused his organization on bringing in the best clinicians and the best clinical resources and the best supplemental resources to address the needs of this most vulnerable of communities. But he didn't stop there. He got the idea to recruit family members and friends of patients to bring patient care into the patient's home where the patient needs it most.
We often refer to LA Care as the people's health plan, and he really lives up to that expectation. His leadership has been incredible, not only looking at the contracting and improving access to care for LA Care members, but also making sure that that same learning benefits even his own competitors. I think that's an extraordinary feature of John's legacy. And the other part is being strategic with grants. And I have not seen any health plan do what he has done with the grants to support its partners, but to also foster innovation. And I think that's a huge part of his legacy. Certainly the elevating the safety net is an innovative strategy that I think other health plans will emulate.
In the legislative process, we say it with regularity. The perfect is the enemy of the good. John gets that and went to work on how we can make a change in the lives of people right now, not tomorrow, but now. When we talk about the dynamics of racial reckoning before such a formulation had been advanced, John was thinking through those issues.
Pioneers, community leaders, change agents, champions to ensure equitable health and well-being for all, community leaders that care and go the extra mile. These are just a few ways that we describe the great work that each of you are doing. And tonight, the American Heart Association says thank you, and we salute you.
You have changed more lives than anybody could possibly imagine. Congratulations, and thank you very much for everything that you've done for all of us.
Congratulations, this is a well-deserved honor, but I hope this doesn't mean that you're going to retire. We need you for the long haul.
To our dear friend, congratulations on a job well done. To Dr. Richard Allen Williams.
We have related to each other as good best friends for years, and I'm proud and gratified to have known Dr. Williams for so many years.
You are prolific, you are iconic, and in the words of Adele, you look like a movie, you sound like a song. And in the words of Tina Turner, you are simply the best, better than all the rest. I love you so very much, and I am so proud to be your daughter.